All right, true or false? 360 lipo involves doing the abdomen, the front, and then the waist. Is that true or false? False. That's not 360 lipo. 360 lipo means 360 circumferential torso, which yes, it includes the abdomen and the waist, but also includes the entire back, armpit area as well. All right, true or false? 360 includes contouring the back and flanks. Is that true or false? True. Yes, it does involve the back and the flanks as well as the front. Remember, it's 360 circumferential torso. There's 8 areas, and it includes all those that we just mentioned. True or false? 360 lipo is a weight loss procedure. Is that true or false? False. It is not a weight loss procedure. I don't promise how much weight will come down. It is a body contouring procedure, which means we change the shape, we change the proportions, but it is not a weight loss procedure. True or false? When we do 360 liposuction, we can use the fat for grafting. Is that true or false? True. Of course we could use it for grafting. That's what a BBL is. BBL doesn't have the best name, but essentially what it is you take the fat you harvest from the liposuction procedure, and then you take that fat and you graft it or put it into another area, transplant it into the buttock for reshaping of the buttock, both for volume and shape. True or false? 360 lipo with fat transfer usually requires 1 week of downtime. Is that true or false? This is a soft call. Let's call it false, but keep in mind that this is very subjective and case by case. So some of this stuff is more objective and fact driven. This one is a little bit not so fact driven and more subjective. I would plan as a patient at least 2 weeks off, sometimes 3. A week, I think we're cutting a little short, so I would say false. True or false? 360 lipo can address certain stubborn areas of fat that might be hard or stubborn areas that don't respond as well to diet and exercise. Is that true or false? True. You could use liposuction for stubborn areas, so it's not uncommon to get someone who's very fit, who puts a lot of time and energy in the gym, and then what they say is that the results they're getting in the gym is not commensurate with the effort. So I hear that story a lot. Sometimes patients use liposuction to target those stubborn areas and create more of an hourglass shape. True or false? There's going to be swelling after 360 lipo. Is that true or false? Everyone's going to say true, but here's the caveat, right? What happens is you say, yeah, I know there's swelling, but you don't really understand it until you're a patient and you're going through it, because a lot of times patients will say, oh my God, it's so hard, and look at this, and it's been 3 weeks and this is still stiff. So we tell you there's going to be swelling, you raise your hand and you say, true, there's swelling, but then when you're actually going through it, it's hard sometimes to understand it. So just keep in mind that that process is 6 weeks, more than 6 weeks, 12 weeks, 3-4 months, where you feel your tissue and it doesn't feel very soft, or there might be certain symptoms such as like soreness or a very slight pain. So yes, it's true, but if you're watching this, keep in mind that until you actually experience it, sometimes it's hard to conceptualize it. True or false? 360 lipo can permanently remove fat cells. The answer is true. It's suction assisted lipectomy, SAL or PAL, power assisted lipectomy. So what you're doing is, lipectomy means removal of fat. So we're actually removing fat, we're removing fat cells, and therefore you decrease the total amount of fat cells in the body. That's why if you gain weight after, it's not as obvious in the areas that were liposuctioned. True or false? Patients can go back to strenuous activity the next day after liposuction. False. Of course you're not going to go back to lifting heavy weights. And I know that this is intuitive, but I think the important thing is the discussion of, well, when can you go back and what's common? Usually 2-3 weeks for lower intensity. As you get closer to a month, higher intensity. These things are subjective. Some of it depends on your preoperative conditioning or how active you were before, but just plan on average. You won't go back to the gym for about 2 to 3 weeks after a liposuction procedure. True or false? The results of liposuction are immediate. So the answer is true. The results are immediate, so you see it right away. But are you at the final result right away? No. It does take a good 3 to 4 months before you get to the final result. So true or false? If you have loose skin, can you still do the liposuction? Yes or no? True or false? The The answer is yes, of course you can still do lipo if you have loose skin. So imagine you're a mom, you're in your 40s, you had a couple kids, you have some loose skin, it may be sagging or hanging, it may not be. Regardless, that doesn't preclude you or prevent you from doing lipo. Now, what's an important distinction is you understand that liposuction is not good for loose skin. Let me say it a different way. If you have loose skin before lipo, you're going to have loose skin after. Another important distinction is that lipo doesn't cause loose skin, but it makes it more obvious if you have pre-existing loose skin. So if you have loose skin, you had a bunch of kids, you gained some weight, and now you take out that fat, you deflate the skin envelope, it may be more obvious to you, but it's not that the lipo causes it to occur. That's why if you lipo a 20-year-old with no kids who has a normal BMI, it's not going to ever generate or create loose skin in that patient because she didn't have any to begin with. Thanks so much for watching. If you enjoyed the video, drop us a comment, give us a like, subscribe. I'll see you in the next one.